That's a monumental challenge in its own right, but becomes virtually insurmountable when patients work against the physicians who seek to help them. Jason Shu, MD, knows this problem well. The co-director of retina research at the Retina Service of Wills Eye Hospital in Philadelphia, Pennsylvania, conducts research on patients with proliferative diabetic retinopathy (PDR), a condition that could be avoided with certain lifestyle changes and treatment interventions. It's easy to understand why these patients, who are often non-adherent to their diabetes medications, are often lost to follow-up after they initially receive intravitreal injections of anti-VEGF for pan-retinal photocoagulation (PRP) therapies. The problem is, neither anti-VEGF nor PRP are one-and-done treatments. Both require follow-up and monitoring to sustain outcomes. Losing patients to follow-up means that positive outcomes will decline, and could even lead to increased blindness. It's a much bigger issue that I think has been given press in our field, Zhu told MD Magazine. At the 2018 annual meeting of the Association for Research in Vision and Ophthalmology, ARVO, in Honolulu, Hawaii. Unless someone in the practice is carefully monitoring these patients, especially these high-risk patients that are getting injections, then those patients are just gone. Shu and colleagues conducted a retrospective cohort study to determine just how serious of the loss to follow-up issue really was. In a 4-year study of 2,302 patients with PDR receiving intravitreal injections with anti-VEGF or PRP, they found that a total of 1718 patients, 74.6%, followed up post-procedure and 584 patients, 25.4%, were lost to follow-up. Of the patients receiving PRP, 28% were lost to follow-up, compared with 22.1% of patients receiving anti-VEGF. Shortly after that data was revealed, Shu and colleagues began work on a follow-up study to determine whether anti-VEGF or PRP could sustain improved outcomes for a longer period in patients with PDR who were lost to follow-up. The findings will be presented at 4 p.m. Hawaii time on April 29 at ARVO 2018, and covered summarily by MD Magazine. Jason Shu, MD, it's a much bigger issue than I think has been given press in our field. We actually just recently published a paper that's in ophthalmology looking at loss to follow-up rates in patients with proliferative diabetic retinopathy. In that study, we looked at patients that got an anti-VEGF injection or PRP, and then were lost to follow-up for a year or more after that treatment. Diabetes mellitus, diabetic retinopathy. Read full story. More health.